You're going to notice for her is we're going to augment her lateral cheek, and so using this as more of a skin tightening or a biostimulant, she will get pull in this direction. So I'm going to use a cannula. We're going to place this in the immediate subdermal plane, and I'm using a 25 gauge 1.5 inch cannula. So for this, we're going to go ahead and make our entry site. Here we go, 1, 2, 3. And this is using a 23 gauge needle. And then as I come out, I'll just make a small, tiny little flick to make sure that's a nice opening there. Now, from that point, the rest of this will be with the cannula. So you notice this cannula is a 25 gauge 1.5 inch. This arrow, or this mark on this particular brand, demonstrates the side that the opening is on. So if we look at the end of the cannula, just proximal to that blunt tip, you'll see the opening. Now, in some cannulas, this opening is a little bit further down the cannula, so it's important to know which brand you're working with. But for this particular brand, it's very near the tip. We're going to go through our entry site. And for her, I'm following along the superior portion of the zygoma, which kind of lifts that cheek up. It'll change the point of light reflection. And now, if we look, we can see that this cannula, I can see it tinting. So you can see the depth that I am right there. And so now I'm just applying a slight amount of pressure and doing a retrograde linear thread of product. Okay, and then I'm going to go and just adjacent to that, I re-advance the cannula, and we're going to inject again. So you see I'm able to deliver the product, multiple bolus of this. It's blunt, so she has very minimal chance of bruising from this. And I'm able to do this all through one entry site.